All right, we have two more sessions today, and it's been a really rich conversation thus far and a lot of really interesting information. I think this next session is focused on policy and what are some of the policy issues that will impact improved access and equity of care. And so moderating this session, we have Sarah Downer, who's the Associate Director of Whole Person Care and a clinical instructor on law, health law, and policy at Harvard Law School. So Sarah, thank you very much for being here and for moderating this panel.
Thank you very much. And I'm really excited to be here. This day has been amazing and touches on so much of the work that I personally do and care about. And so I really thank the organizers. And just so that everyone here knows a little bit about why the Center for Health Law and Policy Innovation at the law school is here. So we really use law and policy as a tool to improve access to care and quality of care for people who are underserved. And the lens that we use to do that, we look at people who are living with chronic illness. Historically, our work focused on HIV. We do a lot of work on hepatitis C. We do a lot of work with cancer. And we are the organizational co-chair of the Chronic Illness and Disability Partnership. And so we try to pull together all of these issue groups and that care about these issues together to speak with one voice, especially given the nature of healthcare, the healthcare dialogue these days. So we do a lot on access to healthcare, access to health insurance, which we know are not the same things, prescription drug coverage. And then my personal work focuses a lot on what types of services are going to make healthcare work for people with complex conditions and how to really change our system through policy to ensure that these services can meet the needs of the people who have these complex conditions. And so I think a lot about integrated services, housing and food being one. And I was so excited, Dr. Chen mentioned in the last session, the pilot in California, because we worked really hard on advocating with the California Food as Medicine Coalition to get the money set aside by the state for that pilot on medically tailored meals. So I was so excited to hear her mention that. And we do a lot to emphasize team-based care, including covering the services of community health workers and others in the team. And in particular, we had that fabulous panel earlier with all of those community-based organizations here who operate on a shoestring budget and do not get healthcare dollars by and large to do the work that they do. And so thinking about as we try to reform the healthcare system, what does that mean for these community-based organizations that are doing the job of introducing more equity to our system? How do we fund them? How do we make sure they're well-resourced and able to take referrals from our healthcare system? And then we do some stuff on technology-based innovation too. And so I'm really excited to be moderating this panel today at this transformative moment in our healthcare system, because the conversation around what healthcare, can and should look like is dynamic, to say the least. So I'm thrilled to be here with these experts who are going to really shine a light on what that means for people with serious illness. So I will introduce Diane Rowland, the Executive Vice President of the Kaiser Family Foundation, who is a leading expert whose work I follow very closely on public policy and research focused on health insurance coverage, access, healthcare financing, especially for low-income folks, an expert on Medicaid, Medicare, HIV, women's health, and disparities. Previously, she's served as the executive director of the Foundation's Commission on Medicaid and the Uninsured, and was the inaugural chair of the Medicaid and CHIP Payment and Access Commission, which we affectionately in my organization know as MACPAC. And then next to her, we have Andy Slavitt, the founder and general partner of Town Hall Ventures, which invests in healthcare innovations in vulnerable communities. He's also the board chair of US of Care, a national nonprofit and think tank working to achieve comprehensive healthcare access for all families. And he was formerly the acting administrator for the Centers for Medicaid and Medicare Services under President Obama. And among many other accolades that he has received, he has been named the most influential healthcare tweeter, which is particularly important for these times in which we all live. And then next to Andy is Lori Bishop, the Vice President of Palliative and Advanced Care at the National Hospice and Palliative Care Organization. healthcare nurse executive focused on interdisciplinary care delivery models for the seriously ill. Joins us with an extensive background in hospice and palliative care, and has been in leadership positions with Sutter Health and Unity Point Health, where she was the architect of award-winning organizational reforms that benefited patients, all while increasing efficiencies within those systems and even reducing costs. So welcome.